Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, my dear students. I hope all of you are fine and your Ramzan is going fine too. Well, today we are here with our third lecture on the principles of pharmacodynamics. Let's have a quick flashback of what we did in the previous two lectures. We defined what is a receptor, what are the various types, the brief outline about it. We defined agonist, antagonist, partial agonist, and inverse agonist with respect to affinity and its efficacy. Today's lecture, the learning objectives would be that at the end of this lecture, we hope that you should be able to classify different types of drug receptors with 5 examples of each type. At this point, students, take out your notebooks and kindly note down for your assignment. You have to write down the various types of drug receptors and give their examples. Like we discussed briefly that there are G protein coupled receptors, there are ion channels and so on. So you have to give example of each type and 5 examples. Find out from your textbooks and write down on your notebook. All right. At this point, I would like you to know that this is a very important question which comes in your professional examination. You can be directly asked, okay, what are the different types of receptors? Like they are going to ask you, okay, what is the example of cytokine receptors, or what is the example of insulin receptor and tyrosine kinase receptor? Or you can be indirectly asked. For example, you can be asked if a patient is taking steroid for its rheumatoid arthritis. So what is the most probable mechanism of drug receptor of steroids? So it is the examiner is indirectly asking you that steroid is acting through which receptors. We all know that steroids are since lipid soluble, and only those drugs or ligands, they act on the intracellular receptors which are lipid soluble. So at this point, this question can be asked indirectly. All right. And in autonomic pharmacology, again, there is overlapping of these receptors. You can be asked, for example, okay, give the mechanism of action of acetylcholine on the heart. So if you know in the heart which type of receptors are present, you'll be discussing that. Like there is a muscarinic receptor, then you should know what is the type of the receptor. So muscarinic are basically they can be G protein coupled, G stimulatory or G inhibitory, or they can be IP3 DAG related. So you should be knowing that you have to write down the type of receptor and its transduction mechanism. All right. So we'll be covering in this lecture that what are the various type of G proteins, what are their second messenger systems, and how do they act. So this is very important, and remember this thing. In this question, you can score mathematical marks. For example, if it is asked M2 receptors का आपने location write करनी है, you have to write down its type of receptor and its signaling mechanism. So it is just you have to write down that M2 is present in the heart, for example, and it is type of G protein coupled, and in further you can say that it's G inhibitory, and then in the second messenger system you can write down that it decreases cyclic AMP through adenyl cyclase pathway. So you will get full marks. All right. So let us begin with the lecture. In the previous lectures, we discussed that there are two main categories of the receptors. They may be surface receptor or they may be intracellular receptors. All right. The receptors on the surface are also called transmembrane receptors, which is they are spanning the lipid bilayer. All right. So the first example of our transmembrane receptor is the ligand-gated ion channel. All right. So as you can see that it is a pentameric structure. If we see from the top 1, 2, 3, 4 and 5. And this is its pore. All right. So when a drug or a ligand binds to the receptor binding site, what happens? There is opening of the ion channel. There is opening of the ion channel and there is entry or exit of ions. Which ions? Like sodium, potassium, calcium, chloride, and many more. Depending upon the type of the ions, like sodium, if it's entering inside the cell, it may cause depolarization, like calcium also. But in case of potassium and chloride, it may cause hyperpolarization. So it depends upon the type of the receptor and type of the ion which is entering or leaving the cell. All right. So this is a ligand-gated ion channel. It's a pentameric in structure. 2 alpha, 2 beta, or gamma unit is present. And remember one thing, students. Examples of these are GABA, glycine, nicotinic acetylcholine, serotonin, and glutamate. This type of receptor acts within milliseconds. So it is having the fastest onset of action. Remember this thing. Alright, this can be asked in an MCQ. For example, you'll be asked that serotonergic receptors take their action, onset of action is occurring within. Options can be microseconds, few seconds, minutes, hours, or days. So the quickest action or the fastest onset of action is that of ligand-gated ion channel, and the slowest action is that of the intracellular receptors. And we'll be discussing it why it has got the slowest onset of action. All right. So if we talk about the G protein coupled receptor, you have to remember that it is transmembrane receptor. It is having the 7 transmembrane helices, and it is attached to it is alpha beta gamma subunit. And remember one thing, alpha subunit carries the enzymatic activity. So G proteins can be G stimulatory, G proteins can be G inhibitory, denoted by GS or GI, or it can be GQ, in which there is IP3 DAG pathway. So in case of G stimulatory pathway, there is cyclic AMP is increased, whereas in G inhibitory, there is decrease in the cyclic AMP. So as you can see, I told you that alpha subunit carries the GTP activity and it activates the adenyl cyclase pathway, and depending upon G stimulatory or inhibitory, it inhibits or stimulates the cyclic AMP synthesis. Another pathway for the G protein is GQ pathway. It binds to the phospholipase C and catalyzes the cleavage of PIP2 to IP3 and DAG. You all know that from your previous knowledge of biochemistry. So let's have a look on the G protein coupled receptor. How do they act in a more detailed manner? As you can see, the G protein is inactive initially when there is no binding of the ligand to the receptor. The G protein is inactive. Or we can say the switch is off. In the second step, when the drug or the ligand binds to the receptor, G protein receptor, the G protein becomes active and the GTP is activated and phosphorylated to GTP. And as you can see in the third step, the now activated G protein is dissociated away from the receptor and moved to the enzyme and turns on the cellular response. The first step was there was binding of the drug to the receptor and activation of G protein, which was inactive initially, and there is activation of the second messenger system depending upon the type of the G protein. G protein, as I told you earlier, it can be G stimulatory, GS, it can be G inhibitory, GI, it can be GQ, which is IP3 DAG pathway. And the step 4 is the G protein is quickly deactivated because the G protein is also a GTPase enzyme. Alright, so this is the last step in which there is deactivation of the G protein once the action is shown. This is the structure of the G protein coupled receptors. And as it is written in the books, it's a serpentine receptor like a big snake, and it is spanning the transmembrane 7 times. 1, 2, 3, 4, 5, 6, and 7. It has got an extracellular domain and an integral membrane portion. So if there is binding of the drug to the receptor, there is activation of the G protein, which is carrying the alpha activity is carrying the phosphorylation, which was inactive initially and then becomes active on binding of the drug to the receptor. This is an example of beta 2 receptor, which is stimulatory. Beta 2 are basically stimulatory receptors, and our main neurotransmitters like epinephrine acts on the beta 2 receptors, sympathetic stimulation it causes. And then what is happening? It is acting through the G stimulatory proteins. Alright, so it's a happy phase. It's binding to the G stimulatory protein, and it is causing through the activation of adenyl cyclase conversion of ATP into cyclic AMP. Whereas alpha 2, it's acting through the G inhibitory protein GI. Alright, that's a angry or sad phase. So there would be decreased cyclic AMP as a result of activation of G inhibitory protein. So different organs or tissues have different types of receptors. Depending upon their function, they may cause stimulation or inhibition of G proteins. So this is another example of the GQ coupled receptors in which there is activation of PIP2 and leading to IP3 DAG release. This is a much more elaborated view. As you can see, there is G protein coupled receptor, it's a serpentine receptor, and there is activation of ATP and there causes the phospholipase C, which dissociates into IP3 and DAG. IP3 then causes the release of calcium, and through the protein kinase C, through the calcium, there is the activation of the cellular responses. So this is the GQ coupled mechanism in which there is activation of phospholipase C and protein kinase C and DAG. So this is another diagram showing the same thing. The G protein coupled receptors, the activity relies within the alpha subunit of G protein. Alright, so you have to remember there is activity in the alpha subunit. So this is a series of events which is occurring. There is activated beta gamma subunits and activated alpha subunit, and activates the enzyme and second messenger system and protein kinase and then to the target tissue. So students, at this point you can see the ligand gated ion channels were showing their action within microseconds, milliseconds. Whereas in case of G protein, there is a number of events which is occurring. Alright, so it is going to take more time. So the fastest onset of action was of the G ligand gated ion channel. Then comes the G protein coupled receptors, because it has to take time. It is going to activate the second messenger system. This is another diagram showing the activation of GQ coupled receptor and the adenyl cyclase pathway, increasing the cyclic AMP, activated protein kinase A. Alright. And this is another pathway, alpha subunit carrying the GTP activity, binds to phospholipase C, PIP2, IP3 and DAG. IP3 causes the release of calcium, and there is activated protein kinase C and then activation of the target proteins and performing its action. Now we move on to the third type of receptor, which is also transmembrane, and it is called tyrosine kinase receptor. Remember, at this point there are two types of enzyme linked receptor. Number one, tyrosine kinase, and number two, JAK-STAT receptors. So you have to notify the differences between the two receptors. First of all, we talk about the tyrosine kinase receptor. As you can see, there are two subunits, we call it two dimers. And there is tyrosine is an enzyme. Its activity is present in the intracellular domain. The extracellular domain is the ligand binding domain, and the intracellular domain of tyrosine kinase receptor carries the enzymatic activity. All right. So what happens when the receptor is activated through the binding of the drug or the ligand to the receptor? These two dimers come close together and it is called dimerization, which leads to phosphorylation of the tyrosine kinase and conversion of these ATP molecules. All right. And then the cellular responses is shown. So this is an example of enzyme-linked receptor. Number one, tyrosine kinase receptor. And one of the most important example is that of insulin. Insulin, you all know, decreases the level of blood glucose and it is acting through its tyrosine kinase receptor. Now, another type of enzyme-linked receptor is JAK-STAT receptors. All right. It is same as tyrosine kinase, that it is consisting of two dimers and they come close together when there is binding of the drugs or the ligand to these receptor. Typically interleukins, interferons are binding to these type of receptors. So what is happening? There is activation of JAK protein which leads to activation of further more proteins, and then there is activation of STAT proteins. So note down over here the difference of this JAK-STAT receptor from the tyrosine kinase is in tyrosine kinase there was enzymatic activity within the intracellular domain, whereas in JAK-STAT there is present not inside the receptor. They are present separately and they are activated through JAK pathway. And ultimately, the STAT proteins are going to go inside the nucleus and then through the transcription and translation processes, then they are going to show its response. So they are also going to take a long time to act as compared to the ligand-gated ion channels. So a closer look at this diagram. Cytokines are majorly the type of the ligands which are going to bind to the receptors of JAK-STAT. These are called cytokine receptors also. So there is JAK proteins are bound to the cytokine receptor intracellularly, which activates or phosphorylates and activates the STAT proteins. Typical examples are that of interferons, interleukins, and various growth factors which act to the JAK-STAT signaling pathway. So this is a closer look at this diagram. Cytokine receptor, there is dimerization and there is activation of JAK and STAT proteins, which further leads to STAT binds to the DNA and leads to the gene expression inside the nucleus. Okay, the last type of the receptor is the intracytoplasmic or the nuclear receptor. For that, it is very important that the drug should bind to the receptor and it should be lipid soluble to cross the lipid bilayer and enter inside the nucleus. The typical example of the intranuclear receptor is that of the steroids. All right, so this drug is coming inside the cell membrane and into the nuclear membrane and inside the nucleus, and it binds to the DNA. This receptor has got a DNA binding domain which when attaches to it, then there is activation of the transcription and translation and then the synthesis of new proteins. So this is how the intranuclear receptors act. First criteria for these is that the drug should be lipid soluble. All right, and this drug receptor complex activation and the response takes minutes to hours to days to show its action. All right, so they have the slowest onset of action. Why they have got the slowest onset of action? Because they have to go inside the nucleus and through transcription and translation and through activation of various proteins, then they show the cellular response. So this was all about the types of drug receptors. So kindly note down in your note copies, in your notebooks, about the types of receptors and with 5 examples for each. All right. Thank you very much and see you next time with the next part of pharmacodynamics. Allah Hafiz.